Hello, everyone, and welcome to the Lupus Foundation's first ever Lupus Education Conference webinar. We're going to wait just another minute or so just to make sure that we get everybody in here into the room, and then we'll start just shortly. So please hang tight for a second. Okay, I have about 2 minutes after, so we will get started. Welcome everyone again to our Lupus Education Conference webinar. We're glad you're joining us today. This is the first time that we've ever done our education conference in this format. And it's the first time we've used this webinar format. So I hope you'll bear with us today as we are testing out this technology for the first time. I want to introduce myself. My name is Amy Onder. I'm the president and CEO of the Lupus Foundation of America Heartland chapter. And also with us is Becca Rich. She's the our events and operations manager at the Lupus Foundation. She'll be kind of making sure that we stay organized and on track today. And I want to start off first by thanking the sponsor for this conference, GSK, Us, and Lupus, for their generous support of this webinar and many of the programs that we have done this year. They've been a great partner and we appreciate them so much. And you will hear from them later this afternoon about some really great resources that they have available to you. And then we'll talk a little bit also about some resources at the foundation. A couple of just sort of housekeeping items. You all are muted and we don't see your faces, which we wish we could, but the way that we're going to function today is if you have any questions, if you look into your over to the right on your screen, you'll see a dashboard, and there's a place that you can ask questions. And so that will be where you will ask your question, and then we will post that question to the presenter. So please make sure that if you have any questions, we will try to get to as many as we possibly can, and that would be where you will ask your questions. If you have any issues or problems today and you want to ask Becca a question, or you can't find something or whatever, you can also ask her question there or in the chat. Can they go to the chat, Becca, or no? Okay, so just post everything in the questions. The agenda for today is we have our first presenter, Dr. Al Kim, and then our second, Bree Strong, and then Angie from GSK, and then we'll wrap it up. So we promise you we'll be out by 12:30 on this beautiful day. So let's get started. I'm really pleased to introduce our first speaker, Dr. Alfred Kim. He is an assistant professor of medicine at the Division of Rheumatology, and he's the co-director of the Lupus Clinic at the Washington University School of Medicine. Dr. Kim's research interests include identifying the mechanisms of kidney injury by the immune system, identifying novel biomarkers of disease activity in patients with lupus, and innovative experimental imaging techniques for kidney disease. Dr. Kim founded the Lupus Clinic and has a unique multidisciplinary approach to patient care. Dr. Kim serves on the Lupus Foundation of America Board of Directors, and we are pleased to have him with you today. What Dr. Kim is going to do is give you a very brief 5-minute or so presentation about the current research around lupus and COVID, and then he is going to open it up to questions. We know a lot of you have questions, and so he wanted to spend most of his time today just talking to you and answering any questions that you have. So make sure that you are asking them in the question section, and we will make sure that we get to as many as we can. So I'm going to turn it over to Dr. Kim.
Hello. Hold on 1 second here. Okay, so I just want to confirm that people can hear me.
Well, they can't answer, so, but
Okay.
I can hear you.
You can hear you. Okay, wonderful.
Yes.
So as this is really kind of an open session. I know based off of the counters that we have with our patients that there's a lot of information gaps out there, and we wanted to be able to fill them in. So I think just to start off a bit, just to lay down some terminology. Obviously, the disease that everyone was talking about is COVID-19. This is for coronavirus disease 2019. It's not the 19th version. It's just because of the year that the disease came out in, which was going to be in December of 2019 in Wuhan, China. The virus that causes this is something called SARS-CoV-2. This is for severe acute respiratory distress syndrome, which is the SARS part, COVID, which is coronavirus, and then 2, because there's actually a SARS-CoV-1, which created a smaller but somewhat similar presentation about 10 years ago. So this is SARS-CoV-2. I think what's been really striking about the entire phenomenon is how rapidly people can get infected by this disease. It is incredibly infectious. And as a result, this is the reason why we have such pretty drastic measures to ensure that we distance each other, that we wear masks. One is what's interesting is that a lot of the other respiratory viruses that typically affect people, the rate of those have actually gone down. And so it'll be interesting to see if we continue to distance and wear masks to see what the cold season and flu season is going to look like, because there is going to, it could either become worse or better depending on how well people can follow these, restrictions. And so that's all interesting. It'll be interesting to see how this plays out in terms of our society downstream. Lupus patients definitely can get SARS-CoV-2 or COVID-19. There are, early on, there was a lot of questions about whether hydroxychloroquine was going to be protective and as an effective treatment for COVID-19. You all know that hydroxychloroquine or Plaquenil, which is its brand name, is a highly effective treatment for lupus. It's the only drug that's demonstrated a survival benefit for lupus patients. So this is the reason why virtually all of us are on we have lupus are on hydroxychloroquine. The main issue, though, moving forward is whether or not people can get the right supplies of hydroxychloroquine. Remember, early on, certain world leaders and influential media people had promoted that hydroxychloroquine was effective for COVID-19. This is absolutely false. The data is quite crystal clear that hydroxychloroquine or Plaquenil is not effective for COVID-19. But obviously, this led to a massive demand for hydroxychloroquine by non-lupus patients and these people were scared. I mean, everyone was scared of getting COVID-19 because it could be quite severe, and this definitely, caused mortality, caused death. I mean, obviously in the U.S., we have the highest death count in the world. Over 200,000 Americans have died of COVID-19. So people have been scared, but unfortunately, this has led to very short supply of hydroxychloroquine, which still amazingly still lingers to today. Part of this reason is because there's been quite a bit of stockpiling of hydroxychloroquine by pharmacies, hospitals, and certain governments. And so this has been problematic because this obviously we can't necessarily access those. And so it's unclear to many people how this is going to move forward. Where are those drugs going to be delivered? How is it going to be delivered? There's no plan that I'm aware of yet to be able to distribute this. I'm sure that this is under discussion at much higher levels than what I have access to. So once I hear, I'll certainly let everyone know, and then to disseminate amongst the people who are part of the LFA. So I'm trying to, okay, so, all right, so are we getting questions? Is it still there? Okay, hold on.
Al,
Yes.
that's just some private chat, so don't worry about that. I will let you know when the questions come through.
Okay, got it. Okay. So I think the future is always going to be a little bit uncertain And it's a little bit more now because of how we're going to be interacting with one another. And a lot of questions that my patients have is, when is it safe to return to work? So I've been very specific with my letters to the patients. I've been trying to ensure that the employer understands how important of a situation this is, that the employer has mechanisms in place to ensure that the social distancing is strictly enforced, that masks are strictly enforced. And in those situations, then I am comfortable with any lupus patient going back to work and actually interacting with other colleagues as a face-to-face type of thing. If they are unable to provide those specific situations, then I request the employer to provide a way for the employee to work at home. And I believe this is going to be. I think the Department of Labor actually protects this aspect. So we're checking into this particular issue right now with a couple lawyers, but I do believe that the employer must provide a way for you to be able to get your work done if the environment is not safe, to be able to do it virtually or remotely, i.e. at home. This does not apply to all of you in the audience. Obviously, it depends on the employer and how well they're able to enforce the rules. I know that there are certain businesses out there that do a wonderful job of enforcing this, and there are other businesses that do not do a wonderful job of enforcing this. And so again, with my patients, I try to make sure I advocate for them, and your physician should be able to advocate for you too. I think this is very important. So I want to make sure that this is going to be something that is going to protect you. Okay. The other thing too is trying to understand how do you protect yourself from coronavirus in the future, especially if you have lupus. So there are a couple considerations here. So yes, lupus patients definitely get COVID-19. Are lupus patients at increased risk of getting COVID-19? The early data, we're not going to know the full answer for probably another 6 to 12 months, simply because the numbers keep fluctuating. But I think the key thing is that there appears to be a very small increase. We're talking about maybe a 15% increase risk of lupus patients having an increased risk of having COVID. And the reasons for this are not 100% clear. I think it's because we haven't fully polled everyone, and as a result, the numbers will switch, I think. But the key thing is that I see that as a very small increase. We typically think of like a twofold, fourfold increase as much higher, and that's going to be a 100% increase or a 300% increase. Here we're just talking about a 10-15% increase. So this is relatively small, even though it is an increased risk. What's more concerning though is that if you happen to get COVID, are lupus patients more likely to get severe disease? This is what the type of disease that lands you in the hospital or worse yet, the ICU. The early data suggests that it does not increase the risk of severe COVID, that having lupus by itself does not increase the risk. But there's a small caveat to this that's important for all of us to understand. If you're on prednisone, right, and a lot of lupus patients are on prednisone, the dose of prednisone is critical in terms of how much risk you are of having severe COVID. If you're above 10 milligrams of prednisone a day, you are at increased risk of having severe disease. This is about, I believe, a twofold increased risk of having severe disease. Might be a little bit higher now, but this is something that we are understanding about COVID-19. Early on in disease, you really want a strong immune response to be able to control the virus. It appears that the people who have a poor control of the virus early on are the ones that potentially are going to develop severe disease. When you have the severe disease, ironically, the immune system is too strong, and it's actually driving a lot of the issues seen with severe COVID-19. So again, I'm going to repeat this because this is a little bit confusing. If you have lupus, you can still get COVID-19. Is that a substantial increased risk? I would say no. But if you happen to get COVID-19 as a lupus patient, it really depends on your prednisone dose. It actually does not depend on any other medication. In fact, there are some medications that actually appear to be protective against COVID-19, or at least reducing the severity, such as anti-TNF drugs. So these you might have seen on TV for rheumatoid arthritis and ulcerative colitis, such as Humira or Enbrel or Remicade. Those early on appears to reduce the risk of having severe disease by twofold, which is interesting. But of the lupus medications that most commonly are prescribed, none of them except for prednisone increase the risk of having severe disease. And that's really important to note. That means that I'm more than willing to start a new medication on my lupus patients, even now during COVID. And so if your physician wants to start a new medication that's not prednisone, you can take it without fear, all right? Don't say no. It's actually worse to have uncontrolled lupus because that really just really makes people have to use prednisone, right? So the last thing we want to do is prevent people to be on prednisone, or at least make sure that they're on lower doses, lower than 10 milligrams a day. If you're above 10 milligrams a day, this appears to be a very specific risk factor in lupus patients for having more severe disease. All right, so this is really important. Do not stop your meds. And if you're on prednisone greater than 10 milligrams a day, talk to your rheumatologist. Try to see whether or not a strategy to reduce your prednisone dependence is being developed, because this is what I'm doing with all of my patients that are on higher dose of prednisone. So this is really important. Do not stop your meds, but if you're on prednisone greater than 10 milligrams a day, talk to your rheumatologist or the prescribing physician to try to come up with a strategy to reduce it. If it requires you to start a new medication, you can start that without fear, all right? So that's number one. The second thing to be able to reduce your risk is to continue to do what the CDC and Tony Fauci are recommending. You know, being able to mask, being able to socially distance, frequent hand washing. These are really important tenets to be able to make sure that you can protect yourself against a transmission of the virus. Obviously, we tend to touch our faces a lot. So this is the reason why the hand washing is so critical. That full 20 seconds to be able to get all surfaces of the hand to be able to kill the virus is going to be important to be able to prevent the transmission or carriage of the virus to your face and then potentially infect you. The other issue though too about masking specifically is that most masks that people use actually modestly or may not actually really reduce the risk of getting COVID-19, but it's really important for the spread of COVID-19. So this is the reason why if your employer is demanding you come back to work, this is the reason why I explicitly write in my letter that if you are going to have this person come into contact with other people, that strict face masks are absolutely mandatory, that this policy cannot be compromised or negotiated. And because if it's really the other people wearing masks that protect you. The only mask that appears to be protective in terms of catching COVID-19 is going to be N95 masks. So these are very specialized masks. They are largely only be able to be obtained through a hospital or a clinic. These aren't necessarily sold, at least the high quality ones, directly to the public, although they're increasing supplies of it. I haven't checked in a few weeks, but I believe that there are some manufacturers that are directly selling to consumers like you guys. But the N95 is really, at first was thought to be non-protective, but there's recent data that suggests that it does decrease the likelihood of transmitting COVID-19 if you are in an environment with someone that's positive and may not be wearing a mask, all right? Again, those situations are very specific, I think. In general, if you are in an environment where people are masked, you don't need an N95, all right? And so again, this goes now back to the specific environment that you're in, and this becomes highly individualized. I'm giving very general recommendations, but each person's situation is individualized, and so this is something that we spend a great deal of time in our clinic discussing with our patients about, you know, what environments are these patients going to that may drive increased risk, and then how do we mitigate or reduce that risk? All right, so I think that's another really important thing to be able to be aware of.
Are you ready for questions yet?
People are in the room, actually.
Are you ready for questions?
Yeah, absolutely.
Okay. All right, I'm just gonna start feeding these to you and you can answer them. We'll try to get to as many as we can. One of the first questions is it safe to go to the hospital, into the hospital?
So it's a good question. I think it is actually potentially safer because we have a strict masking policy that everyone is screened. For example, when I come to work, I'm in my work office right now. Everyone is screened. Everyone's temperature is taken. You are not allowed in the hospital if you refuse any of those things, and you're also not allowed in the hospital if you refuse to wear a mask. So compared to the general public environment, this is actually, I think, a safer environment. Yes, we do have COVID positive patients here, but they're really separated in the hospital from other units, right? Airflow is different. They're on different floors and different units, so they are physically separated. So yes, it is safe to go to the hospital. It's safe to go to the clinic. Again, the key thing for lupus patients, you guys know that your disease can strike at any time. It's kind of unpredictable in that way. And the problem is that we want to make sure that we are able to catch it in an early stage of a flare before we need to use such as things like high dose steroids for a long period of time, which I mentioned before is a risk factor for developing more severe COVID. So definitely it's a safe environment. I have no concerns whatsoever myself.
Great. Okay, this is my own question, then we'll get to some of the other ones, but we've been asked a lot about flu shots, and should I get a flu shot? If I have lupus, maybe I shouldn't get it, and when should I get it? So can you address that?
Yeah, so a hard yes for flu shots, and this is not just this year, it's every year. The entire fear of flu shots is confusing to me. I know there's a lot of discussion.
Hey, Al, can I say, if there's somebody who's on one of our presenters who's typing right now, can you mute yourself? Somebody's on that is not muted. All right, go ahead, Al.
Okay, so definitely 100% everyone should be getting a flu shot. I get a flu shot every year. Of course, my work mandates I get a flu shot every year. But I encourage all my lupus patients to get a flu shot every year. It actually ends up being a long discussion with the patients that don't want to get it, trying to understand why they don't want to get it. Some of the people say that, well, I've never gotten the flu in the past. That means I'm probably not going to get flu in the future. You're playing with dice here. We know that patients with lupus who are on immunosuppressives that get flu, they don't do as well as non-lupus patients. So this is largely the reason why we advocate for flu shots. Other people say, well, it makes me sick. Well, it actually makes me sick too. I feel pretty crummy for a couple of days. And part of this is because the flu vaccine is actually generating an immune response to the flu vaccine itself. And part of that, unfortunately, makes you feel a little ill. But imagine if you happen to get the flu, the real bona fide flu, it's going to kick your butt even a lot in a much more severe nature. So, and of course, it increases the risk of having severe issues because of the flu. So again, I understand the reasons why people don't get the flu shot. I think, though, that the price that's paid is both not only reversible, but also minimal compared to the ability to prevent you from getting flu in the future. Because I've gotten the flu once, and it's very debilitating. So really, everyone needs to be vaccinated. I think even in this time of COVID, everyone still needs to be vaccinated. And this is a really important, not just a policy for patients like you guys, but it's a public health issue too.
Great, thank you. Okay, this is a good question too. I think that how safe will the vaccine for COVID be for people who have lupus?
So the FDA is really on top of this. They're not going to release an unsafe vaccine. So let's just put that aside. Of course, there are a small percentage of people that may have a side effect from the vaccine. Of course, we don't know what those side effects are because the clinical trials are ongoing right now. For me, because of my nature of work, I'd be first in line to get a COVID vaccine. I need to be vaccinated because healthcare providers are at much higher risk of developing COVID because of the interactions we have in general. So I can't explicitly talk about the safety issues because we actually don't know what they are. And particularly for lupus patients, I think there are some studies ongoing within the entire there are going to be future studies that will be going on with specific disease populations such as lupus and other diseases to make sure that the vaccine is safe. One thing to mention is that a ton of new technologies have been introduced now for vaccines. So it's not just like taking the virus and killing it or making it a lot weaker and then injecting it. They are using a lot of DNA or RNA-based vaccines. This is very like molecular biology based that could elicit immune responses. These have been tested kind of in a much smaller platform for many years. It's just this COVID-19 pandemic has put those technologies and kind of accelerated their timeline. So it may be interesting to see whether or not these are actually better or safer than traditional vaccines. So from a vaccine perspective, from a medical vaccine perspective, it's actually a very exciting time because we'll learn a lot about what we had proposed in the back in the day about changing the type of delivery of vaccines. So this is going to be something to I'm keeping my ear close to the ground. But I think for the vast majority of people in this room, I think in general, the COVID vaccine will be safe and protective.
Great. Okay. Again, I'm going to point out that we've muted everybody, but somebody is, I don't know who's on, but we're hearing typing. So if you're one of our presenters, if you can make sure that you are muted, we would appreciate it, because I'm not sure who's on there. So, okay. Okay. Let me go back. I'm sorry. Okay. So another question is about other people. So somebody was talking about, that they wear masks at work and are socially distanced, but they have children in school or in daycare that can potentially bring it home to them. Is there any way to address that?
So kind of like collateral damage, infectivity in a way.
Right.
This is, so this is really, I think the key thing is trying to, that's a good question. I think the rush to get the students back into school specifically, I'm not 100% comfortable with it because of this reason. It's, the schools are going to try to mask, but we are seeing students becoming infected and the teachers too. So this could be a potential source. How do you protect yourself against that? Part of it may have to be limiting contact with those type of people, but obviously this is unreasonable, especially if it's your family or an extended family member. I don't think the system has a good solution for this right now. It's not like when you go home, like everyone, continues to wear a mask. And so that's a great question. I don't have a explicit solution. Because it really depends, again, like, thinking about when I was talking about earlier about you and your work, right? And if they're saying that you have to come back to work, of course, it's my mandate to make sure that the patient's safety is prioritized. And if the employer is unable to guarantee to me that the workplace environment is strictly adhering to CDC guidelines, then I write another letter saying that you need to provide resources for this person to go home and continue to do work, right? I mean, again, I believe this is a federal law, right? This is different when you have these other situations, right? And so I don't know if the system has an effective solution for this particular issue. And again, it goes back to the school itself. How strict are they in enforcing these guidelines? I can tell you schools in Florida, like high schools, they're not following it at all right? There may be a political spin to this that I'm going to disagree with, but nevertheless, I believe there is, it's really wreaking havoc from a public health perspective. And we know places like Florida, Texas, parts of California, Arizona, they're still having a substantial issue trying to control the virus. So yeah, that's a great question. I wish I had a clearer answer for you. It kind of bothers me too. So I don't know the answer for that.
Okay. Another question. Any special precautions for lupus patients who have had transplants?
So that's a great question. Like I said, it does not appear that unless you're on prednisone, it does not appear that any other drug that affects the immune system increases the risk of having severe COVID. All right, which is surprising. It is surprising to me, but I think we're learning a lot of nuances about this particular type of virus versus other viruses. I mean, it just behaves differently. So again, you can take your transplant medications with confidence. The most important thing is to try to avoid situations where you have to take prednisone. And I still prescribe prednisone to some of my patients because I want to be able to control their lupus. And if their lupus is out of control, that means they're going to be on higher doses of prednisone in the future for a longer period of time. So, I discuss with my patients, this is a risk factor, but if we don't control it now, it's going to be a lot worse in the future. And so this is, again, it's that compromise. Am I increasing risk of them acquiring COVID-19? I am. But again, if we leave it untreated, a minor, like a small flare, it's going to turn into a major flare in the near future, which is going to dramatically increase the risk of COVID-19 severity if they get it, because we're going to have to use higher and longer doses of prednisone. So again, it's a nuance, and I can't ever say yes or no. This is a very specific type of situation, but it applies substantially to lupus patients.
Great. Here's another question. Again, this is about, I think there are a lot of questions around the future vaccine for COVID. This one is, I heard that some of the vaccines that are in production for COVID are intended to boost the immune system. Would this be safe for people who have lupus?
Same thing with flu shots, any vaccine, right? Boosting the immune system is kind of maybe the wrong way of putting it. It is boosting it against flu or SARS-CoV-2, but it's not like stimulating to the point where the entire immune system goes out of control, right? That's not to the vaccine's advantage. I think you would actually have higher side effects if that happened, right? So when we're talking about boosting the immune system, again, I would describe it as if you're developing protective immunity against what the vaccine is protecting against, right? So if it's a COVID-19 vaccine, you're developing protective immunity. We colloquially say it's boosting our immune system, but I think that's the wrong way of putting it, all right? But it's a simple way for the media and for people to just have casual conversations about it. But when you really break it down, it's actually not the right term. So these vaccines, I think are going to be largely safe for lupus patients. Again, the data is still being generated. I reserve the right to change my mind in the future once the data are available and open for our own specific analysis.
Okay, great, thank you. I think you've answered this, but I'm just going to ask it one more time just so you can reiterate. Are there any lupus patients that are more susceptible to COVID by way of the treatment they take or the kind of lupus that they have?
Right. No, and I'm going to repeat this over and over again too. So there's two things you have to consider. Am I at higher risk of getting COVID? All right, and that's one umbrella. A sub umbrella within there is, if I happen to have COVID, what are my chances of having more severe disease where I have to go to the hospital or worse? All right. So the bigger umbrella, are you at increased risk of COVID? The data is early on, and I don't think we'll have a full answer for 6 to 12 months. But it appears that lupus patients are very modestly at increased risk of getting COVID. Again, this is not, I don't know if it's because of the disease itself, COVID-19 or lupus itself, but it may also reflect the environment that the patient is in too. Maybe they are in environments where people don't mask, right, which substantially increases the risk of transmission, right? So again, that's part of the story will be unearthed in the near future. But as of now, I kind of treat lupus as not a risk factor necessarily for getting COVID, right? But let's say that you happen to have COVID. The only thing that increases the risk of having severe disease, right, the people that land in the hospital, is going to be prednisone use, but not just any prednisone dose. It's going to be above 10 milligrams a day. those people have about a 2 to 3-fold increased risk of being hospitalized once they get COVID. So this is something, again, I mentioned earlier, is that we are working very hard with our patients that are on 40 milligrams of prednisone, 20 milligrams of prednisone, trying to come up with a strategy to be able to maybe add a medicine or change their medications to be able to reduce their dependence on prednisone. So this is another nuanced and important point, is that the data right now suggests that any other medicine for lupus, so this is like Cellcept, certainly hydroxychloroquine, azathioprine or Imuran, Benlysta or belimumab, don't increase the risk of severe COVID. They do not, all right? The data suggests that. So that's the reason why I can tell you to take your lupus medicines with confidence. All right. If you stop taking your lupus medicines, what will end up happening is that you may flare. And if you happen to flare, then we have to use prednisone, which then increases your risk. So if you continue to take your medicines, you're in remission, you absolutely need to continue to do this. And you can do this without any fear of having an increased risk of having severe disease. But if you stop, the main issue here is that we have to use prednisone in the future. So stopping a safe medicine within the context of COVID to then introduce a medicine in the future that increases the risk of severe COVID, you can see why that doesn't make sense. So continue your medicines. Even if your physician tells you to start a new medicine, you can do that safely, all right? And I would actually do it earlier than later, so that prevents you from opening up any opportunity to have to use prednisone in the future.
Great. Have you had any lupus patients that have gotten COVID? And if so, how did they fare?
Yeah, we have. I think in our own clinic, we've had a small percentage. I believe we have over 400 patients that we see within our own lupus clinic. And I think the last number was 8 of those 400 plus people. Unfortunately, one of those people did pass away because of COVID. She was on high dose prednisone, and unfortunately, we were unable to reduce the dose. She just didn't do well with any other medication. We weren't unable to control it. So that was a situation that we felt like we lost control of, largely because we couldn't find a medicine that worked for her. So again, with this one death out of over 400 people, that's not so bad. Again, but we've been very aggressive making sure that we can try to reduce the prednisone utilization, the dose in particular. Again, if you're below 10 milligrams a day, the data is quite clear, you're not at increased risk of developing severe disease, even if you happen to get it. So again, don't stop your medicines, because this is absolutely important to make sure that we prevent a scenario in the future where you're on higher doses.
This is my own question, sort of observation. I've heard a lot that for someone who gets COVID, let's say whether you have lupus or not, and you're hospitalized, don't they blast you with prednisone? Isn't that proven to be a way to treat someone with COVID?
It is. And so again, I demand out of my patients to have them appreciate nuance, and because this is very complicated. Yes, prednisone for severe disease may be an effective treatment, but again, I mentioned this very early on, but kind of in a roundabout way. The timing of your immune response is absolutely critical in COVID. Your immune response early on needs to be very strong, right? That is able to control the virus. If it's strong and is able to control the virus, this virtually eliminates the risk of having severe disease downstream. But if your immune system, particularly with prednisone 10 milligrams or above, is weak, then the virus in a way can overwhelm the body, at which point then the immune response later in severe COVID actually hurts the patient. It actually becomes detrimental. This is actually similar to the case of influenza, that younger people with influenza that don't do well, it's not because the virus is out of control per se, it's because the immune response to the virus is out of control. So one thing that we're seeing a lot in severe COVID is that it appears to be in certain patients a very hyper-inflammatory response, one that's out of proportion to what we would expect in a viral infection. And it's this that's triggering a lot of the complications that we see in severe COVID. So early on, if you happen to get infected, your strength of your immune response is really important. But later on, when the virus is out of control and your immune response is hyper aggressive, then suppressing the immune system is actually a good thing. So it's complicated, it's very nuanced. And so this is, I think, the reason why there's a lot of confusion about that. It's a good question.
Another question just has to do with how long do you think this is going to last? How long are we going to be living with COVID?
Until it goes away, right? I mean, you can't. There's no way we're going to be able to predict the future. I mean, if I had to throw an answer, well, I don't know. Largely, it depends on whether people follow public health policies, right? If everyone can mask and distance, then it will end much sooner than later. But it's clear that when these rules are relaxed, that's when outbreaks occur, right? So if you think about the St. Louis region, I'm just going to use arbitrary levels of severity. Let's say that when it first came out, that the level of severity in the St. Louis region was a 5, right? And then went down to like a 3, but then in around late May, early June, things started opening back up. The level spiked to like a 9, all right? And I think part of this was that people weren't necessarily wearing masks or even wearing masks correctly. So I'm just going to show as an example. If you're going to wear a mask, it needs to cover the nose, right? This is totally ineffective if the nose is showing, all right? Because this is part of your airway, right? You can breathe through your nose, and what we're trying to do is limit the airway spread of any virus. So you have to have it cover your nose. And I have to remind people that, I think your face mask may have slipped. They may actually have always worn it below the nose, but you really want to make sure that it's above the nose. And if you have like one of these medical type masks, these disposable ones, there is this bar over the top, right? Pinch that bar around the nose, all right? If I wore a mask, I'm going to unpinch it, where it just loosely covers the nose, you can see down into it. That's also ineffective, all right? You have to put it on and then pinch that thing around. So when I tug down, right, there's resistance, right? If I don't put that bar across my nose, as pinch, I tug down and it comes all the way down with very little effort. So you got to put it on, pinch it, right? So that make sure that you have the air coming through the mask as opposed to around the mask, all right? This has been so hard to teach people, and so yeah, it's been a challenge. So with all of those considerations in play, I actually think this is going to last longer than we think, all right, until we can really make sure everyone's following the rules. But we're humans, and particularly in America, I don't think many people like rules. So that's also the reason why I think it's going to last longer. Could it last over a year? It could, absolutely, right? This winter is going to give us a lot of information. I think this winter is going to give us a lot of information.
Thank you. All right, we have another question. Do you foresee people who have had and survived COVID-19 to develop autoimmune diseases in the future, i.e. studies comparing autoimmune disease to those who've had Epstein-Barr virus?
Okay, so this is a very complicated question. So we'll first start with Epstein-Barr virus. There are studies that suggest there's a link between Epstein-Barr virus and autoimmune diseases. The reality is that 99% of people in the world have been infected by Epstein-Barr virus, all right? It doesn't mean it's not a trigger. I think it could be a trigger in a select group of people that we can't identify, all right, yet, all right? It's not like I know who's going to develop lupus in the future. We don't know those people. So is it something that we need to treat? It's kind of, well, it's unclear, right? I think that's an interesting question. But when you now look at COVID-19, there are small reports, and again, this is very infrequent, where you happen to have kind of a specific autoimmune type response that is not that can occur actually with other viruses. So we've seen people develop a rheumatoid arthritis type picture, but this has also been seen in other viruses. You may have heard of this chikungunya virus maybe 5 years ago that kind of spread, especially in the southern United States. This can cause a rheumatoid arthritis-like picture also. Hepatitis B in particular can cause a rheumatoid arthritis type picture too. So there are other viruses that can do this. We've also seen kind of this very specific type of rash, particularly in children, in the hands and feet that is reminiscent of an autoimmune disease. So the short answer is yes, COVID-19 can cause autoimmune disease, but again, the nuance is very important. Before you freak out, it's a very small percentage, all right? I'm not concerned necessarily of developing autoimmune disease if I happen to get COVID-19. Of course, we could be wrong because this is still very early on in the pandemic. We are going to have a much clearer idea, say next spring or summer, once we have a full year and be able to really see how the manifestations of the virus plays out in the world population. So right now, it does not appear that it's a common that autoimmune disease commonly is associated with COVID-19. It seems to be very specific at very low rate. So
Great. Okay, if you get COVID-19 and you get better, are you able to get COVID-19 again?
Great. We don't know yet. So in general, typically, if you get infected by a virus, you're not going to get infected again by that virus. The coronaviruses in general tend to change very slowly or mutate very slowly, as opposed to the flu virus. The flu viruses mutate very rapidly, and this is the reason why we have to get vaccinated every year to kind of to be able to anticipate this change. Yeah, so coronavirus is much more slowly mutating, but there have been intermittent, very small reports that people may be reinfected. And there's been one person in the US that got reinfected. And when they compared the virus that they got initially infected with versus the virus they got infected with later again, they were two different strains in a way of coronavirus. So, the possibility is yes. It's too early to say how common this is. As of right now, it seems to be an extremely rare event. But generally, we think that the immune response that you generate because of an infection, it's kind of like a hyper vaccine, right? When you get infected by a virus itself, that's essentially a vaccine also, right? So the chances of being reinfected are going to be dramatically reduced. And we still think right now, as of end of September 2020, we still think this is true for COVID-19 also.
Okay. What is the difference between the symptoms of flu and COVID-19, and how will you be able to determine which is which?
Yeah, so that's a great question too. So flu has these really high fevers, substantial body-wide aches, and a lot of these people are going to be coughing also. It can obviously infect the lung tissue. COVID-19, somewhat similar, but the severity of the fever tends to be lower. You don't necessarily, some people do, but most people don't actually have the body-wide aches as much. You don't necessarily have a runny nose. So this is actually important when you compare it against allergies, which is still a problem right now. Right. So if you have allergies, if you have an itchy nose, if you're going like this a lot, that's not what you see with COVID-19. That's actually not what you see with flu. That is very specific to allergies. So you can be reassured they have an itchy nose, runny nose, itchy eyes. That's not going to be COVID. But COVID also has, strangely, so many other symptoms that are a little bit weird. Loss of taste or smell is one of those symptoms. So it's in a way, COVID-19 presents a little bit less dramatically than flu, but it also presents in a much more diverse way than flu. All right. So I think if you feel like that you have, if you've been exposed to someone or you think you had COVID-19, the tests are now available. to be able to check it, to have it checked. And if you don't have instant access to one of these tests through your physician, and there are a substantial number of physician offices that are unable to provide these tests, you can go to either CVS or Walgreens online and be able to actually get a test that way. Right? So you basically drive up to the store, you're going to be put into queue in your car, and then you actually do a self swab. There are newer saliva tests that are coming out that seem to be as accurate. One of them got developed here at WashU, and the data looks pretty impressive. So that would be a lot easier than having a swab being put into the back of the nose in areas that you didn't realize existed.
Okay, we have another question. It's about herd immunity and COVID-19. Maybe you could just explain what herd immunity is and how we get there.
Yeah. So herd immunity is a concept we've seen with other diseases. So once a certain percentage of the population within the community is infected, basically it reduces the ability of that virus then to transmit. This actually happened with that chikungunya virus that I explained earlier. Once you get infected by chikungunya, you can't get it again. So what happened is that we saw a flare, a dramatic spike in the number of chikungunya cases in Florida, in the Caribbean, but then it went straight down because almost, a substantial percentage of those people got infected. And as a result, once you get infected, you're not protected. So if they got chikungunya virus again, the immune system clears it out before anything else happens. So once a certain percentage of the people achieve that type of immunity, the spread of the virus then basically goes down to zero, right? In COVID-19, it was thought that herd immunity could be achievable. It's a little unclear at this point. And this goes back to the question of whether or not could you get reinfected by COVID-19. I think the thing that's very confusing to me is that about 30 to maybe even up to 50% of people who get COVID-19 actually have no symptoms whatsoever. And so I've been tested and I've been fortunately negative, but I could, because I'm not symptomatic, I could actually have been spreading it to other people. And so this is kind of where, if this is occurring, then why haven't we achieved herd immunity yet? So this then goes back into the idea of how, can you get reinfected? All right. So there's still a lot that's unknown, unclear about this. Numbers about percentage of people that are required to achieve herd immunity have been thrown around, like 25%. That's way too low. I mean, I actually don't know what it is for COVID-19, but it's not going to be, I would imagine it would have to be closer to the 40, maybe even 60% of the people. Again, that's a total guess. We still don't know. Is it achievable? Potentially, but I don't know if it's achievable in a way that then prevents the need for a vaccine. All right, we will achieve "quote unquote" herd immunity once we have an effective vaccine out. Right, yeah. Then you don't have to worry about it.
Okay, here's another question. Do you have any particular masks or tips to help people who have difficulty breathing when they're wearing a mask?
That's a great question. I actually don't. I would have to maybe talk to our pulmonologists or other people, infectious disease doctors, to see if there are specific tips for those type of people. That's a great question. I'll have to get back to you on that.
Okay. I don't see any more questions, but if anyone out there has more, please, we have just about 5 minutes left. So Dr. Kim is here for 5 more minutes. Here's your chance to ask. And if you have a question outside of COVID and you'd like to ask him, he can't answer any specific questions about your particular lupus since he's not your doctor. But if you have any other questions, I'm sure he'd be willing to answer them. So I'm going to give you all a second, and if we have no more questions, then we can wrap it up. Or if you have, oh, here's someone. Okay. What about KN95 masks?
They're not true N95 masks. They are a mask though. They aren't, it's not the same kind of density of the fibers within the mask itself. Are they better than traditional masks? I actually don't really know. I will have to get back to you on that. But I treat KN95 masks probably no differently than a traditional mask. We could make an argument that's a little bit better than a traditional mask, but true N95 masks are probably the most important. That's the best barrier. If you have to be around other people.
What about the masks where people are putting in like filters, like, I've seen those before where I would imagine that gives you at least a level of protection outside of just plain material.
You're absolutely right, Amy. I agree. And so I think, for example, I also have a cloth mask that my wife had made me. And so the cloth masks are okay, but we did put in a filter underneath, to be able to provide additional barrier protection. So again, I don't know if it'll decrease the risk of me getting COVID, but it certainly decreases the risk if I happen to have COVID of spreading it. Right. And so I like the cloth masks too, because you can wash them. Remember, COVID-19 can live in these surfaces for a couple days. All right. Potentially. I mean, the vast majority of the virus dies, within an hour or two, but some particles can live longer. Whether or not that's a risk factor for developing COVID later on is unclear to me. But at least, if you're going to be using something like this, yeah, she made a couple for me and we just wash them, So.
And you have to wash them frequently, correct? I mean, I was kind of guilty of wearing mine for like a week, and then I saw something where you should really wash them every day.
Yeah, in theory, yes, that would be the best way of doing it. Yeah.
Okay. This person said, I also have a plastic insert that helps me feel less claustrophobic. What do you think about that?
I have no idea. I would want to look at the plastic insert. Yeah, I mean, I guess I apologize. I haven't really kept up with the masking technologies that are out there.
I've seen them, Al. I think they're also helpful just so the mask isn't touching your face all the time. I've seen that. I'm not sure that it offers much more protection, but I think it pulls the mask, like if you're wearing a homemade mask, so it's not touching your face. I think a lot of people are complaining about getting blemishes or rashes from wearing a mask for.
I got it. Yeah, as long as the seal can be made, and doesn't have to be an airtight seal, it's just enough of a seal where the airflow is going through the mask. Then however it's done, if you can achieve that, then that means it's working.
Okay. Any home remedies, foods, vitamins, etc., to beef up your immune system against COVID?
Nothing we know of. I know there's a lot of chatter about that, like vitamin C, vitamin D. The data is not there. In general, the data isn't there broadly. So I think part of this is that everyone's going to be different. And if you have confidence in a particular approach, that doesn't mean you have to change it. I'm not going to endorse one or the other because, again, I right now, based off data that's available, I don't think it's effective.
Okay. Two more questions. What about protective eyewear as a barrier?
So I think if you're in an environment where you're going to be encountering someone with COVID, which is a very specific and rare situation, obviously in the hospital that occurs, protective eyewear, and in fact, what we do is actually just have an entire face shield is what we do. In the general public, is protective eyewear helpful? It might be. I think that again, it depends if you can tolerate it. So I wear glasses, but this is not protective eyewear. You'd want it to be able to seal around the eyes. In the perfect world, if we were able to control everyone like a computer game, yeah, I probably would have everyone wear protective eyewear. But I think there are potential certain limits in terms of where then you get dramatic backlash, kind of like what we're seeing with face masks in certain parts of the country, right? So I think, again, if we can limit the spread right off the bat, that's going to be important. And so the face mask is probably the most important thing in order to prevent the asymptomatic people from infecting people around that person.
And a shield without a mask is useless, correct?
Yeah, I mean, again, it depends on how sealed that shield is. Most shields just go straight up the front, and so air can go underneath. So I agree, you still would want to wear a mask underneath that shield.
Okay. I'm not sure. This question is, have you seen more people being diagnosed with lupus? I don't know. I'm not sure if that means because of COVID or.
Yeah,
no.
we have not. Again, they are two distinct diseases. We're diagnosing lupus at the same rate as we did before, but again, we're still very early on in this pandemic. Remember, the virus really didn't become established until December of last year, so we're under a year, right? So we still have a lot to learn about this virus, but early on, it does not seem like that. COVID-19 may be a risk factor for developing lupus. Again, I reserve the right to change that in the future, but right now it doesn't seem like there's a relationship.
Great. Okay, I think that's all we have time for. It's a little after 11. If any of you have more questions, we'd be happy to pose them to Dr. Kim and we can get back to you. But it looks like we got through most of them. So I just want to say thank you very much. Dr. Kim has been a great advocate for our organization and does just about anything we ask him to do. So I know you all appreciate his time today. And so thank you very much, Al.
All right. Thank you, Amy.
Bye.
Bye.
Okay. So our next presenter is Bree Strong. Bree has her master's degree in social work and in business administration. She's a licensed clinical social worker and a behavioral case manager for Mercy Clinics. She provides therapy services to individuals with chronic medical issues. She's also been living with lupus for the past 18 years. Bree's also the facilitator of one of our online support groups. So if you're interested in joining a support group, Bree is one of the great people who facilitates for us. Bree's going to be sharing some strategies for managing stress and caring for yourself during the pandemic. If you want to go ahead, Becca, and let her share her screen, and Bree, you can pull that up. And then again, Bree's going to do a presentation, and then she's open for questions afterwards. So if you want to pose your questions in the question box, we will try to get to as many of them as we possibly can. So I'm going to turn it over to Bree.
All righty, let's see here. I'm trying to get this all pulled up. Give me just a second.
Yep, I see it now.
All right, how's that? Can we see all that?
Yep, you're good.
Okay, all righty. So as Amy said, my name is Bree Strong, licensed clinical social worker. I've worked in the community in a lot of different ways. I've worked with an inpatient psychiatric unit, but most recently I've been doing counseling or therapy services for those with chronic mental illness. In my current position right now, I'm actually developing a program that integrates behavioral health into a primary care setting. Once again, as Amy mentioned, I have had lupus for the past 18 years. There's been a lot of struggles and ups and downs, and COVID has really impacted and changed a lot of that. I mean, there's pluses and minuses to it. I do enjoy being able to order something online, drive up to the store, and they put it in my car and I go home. I really like that piece of it. And I like the piece that there's, doctors are able to see by video, so I don't have to get out and try and get to the hospital or to their office or anything. But there's a lot of ways that COVID has impacted us, even ways we don't even know yet. And the overwhelming uncertainty can just be a lot to cope with. And it's impacting our mental health. So these are just the guidelines we've all heard a million times. I know Dr. Kim touched on some of these as well. It's just keeping ourselves safe and following the guidelines and restrictions for your state or county. The struggle with these is that it's having negative impacts on our mental health. It forces us into, these restrictions can force us into isolation, restricts our physical contact with other people that we care about, and kind of keeps us away from the things we enjoy to do. Saving our physical health, it's really impacting our mental health, but there's things we can do to help ourselves and others. So this is just a list of some of the common feelings that you may have during COVID-19. We all react differently to stressful situations. So you may be feeling increased anxiety, worry, fear related to like your own health status, the challenges of like getting the things that you need, groceries or other things that you need to get from stores. How are you going to access those? Concern about being unable to care for your kids or maybe others in your care. Just uncertainty and frustration about how long this is going to last. How long is it going to be are we going to be isolated? Boredom and frustration is another piece. You know, these are just really difficult times with the threat of COVID. So one thing I do want to really make sure I point out, don't delay getting medical attention for your condition because of COVID. Emergency departments have contingency infection plans and to protect you from not getting COVID. And Dr. Kim had kind of touched on that as well. So self-care, that's what we're going to really get into today is what is self-care? How do we do this? And how can we be successful at it? So self-care is an activity we do deliberately in order to take care of our mental, emotional, and physical health. It seems like a simple concept, but it's something we frequently overlook. And really good self-care is the key to having an improved mood and reduce anxiety. So sometimes knowing what self-care isn't is probably more important than what self-care is. So self-care is not something we force ourselves to do or something we don't enjoy doing. Self-care is something that refuels us and doesn't take from us. And it's not selfish either. It's not only about considering our needs. It's rather knowing what we need to do in order to take care of ourselves. You know, I can't take care of myself. If I can't take care of myself, I'm not going to be able to help any of my loved ones. I can't be a support for someone else. So do you need more self-care? You know, some of us practice self-care and we think that we're doing some of those things. You know, these are some of the self-care checklists that kind of, you know, if you're struggling with these things, maybe you do need to incorporate more self-care into your life. You know, if you're always pushing through or feel stuck in survival mode, if you do some self-care, quote unquote, like when you have time, you probably need to stop right now and start doing some self-care. This should be a non-negotiable part of your life. So this is just a reminder. Taking care of yourself, participating in self-care does not mean me first. It means me too. It means I need to be taken care of too. I'm going to take care of you, but I'm also going to take care of me. So what happens if we don't do self-care? I don't know about you guys, but when I'm not making time to take care of myself or prioritizing my own self-care, I become crabbier. It's much easier for me to be snippy and less understanding when I'm talking to others. I have kind of a short fuse when I'm at that point where my energy is low, I have less patience, I'm extra achy. So these are just some of the examples that you can experience if you're not practicing self-care. It kind of catches up to us. And most of these symptoms can be related to lupus, but you know your body. Be honest with yourself. Is this a consequence of maybe staying up too late or burning both ends of the candle at the same time? So if you've noticed any of these symptoms or reactions in yourself, maybe you have, but you aren't sure exactly how to change it. Changing habits we've been stuck in for a long time can be challenging, but these are things that can be done. We can improve our self-care. So here's the self-care wheel. Olga Phoenix, I believe she is a psychologist. I can't remember. But she created this comprehensive wheel, and it's just a preventative tool. There's 6 different categories of self-care, and each piece of the pie gives examples of self-care activities that you can participate in. I've also attached this at the end of the presentation, so if you guys wanted to look at this a little bit closer, you would be able to easily pull it up and look at it. So psychological, some of the activities that are related to that are self-reflection, journaling, drawing, therapy. Emotional would be like self-love, laughing, crying, forgiving. Spiritual, meditate, sing, dance. Personal would be socializing with friends, setting goals for yourself. Professional, taking lunch when you're working, and maybe saying no or not doing as much overtime. And physical, safe housing, or and by safe housing, I mean maybe you would feel better if you were in a 1-story house versus a 2-story house because you're worried about trying to get up and down the stairs. Exercise is one. I personally don't like the word exercise. I prefer movement, but that would be another physical way to do self-care. Sleep, or go on vacation or a staycation, all pieces of self-care. So where do we start? So now we know that we need some self-care. What do we do next? So these are kind of like the 3 golden rules of self-care. So the first one is just sticking to the basics. Nourishing, hydrating, bathing, sleeping, meds. The second one is a plan. So actively planning self-care rather than it's something that happens. You're making an active choice to participate in self-care, adding certain activities to your calendar, announcing plans to others so that it increases your level of commitment, and looking for different opportunities to be able to practice self-care. And the last one is self-awareness. I really feel that this is one of the important pieces. So kind of keeping that conscious mind, that awareness. So if you don't see something as self-care, then don't do it. You need to be able to enjoy it. It just won't work if it's not something that you enjoy. So be aware of what you do, why you do it, how it feels, what are the outcomes, what keeps that self-care in the forefront of your mind. So back to the basics. So this is the first golden rule here. And we all know these things, but they tend to be the first things that we kind of toss out the window. So really paying attention, eating healthy meals, hopefully, if at all possible, at the same time each day, staying hydrated. Bathing, that can be a huge challenge for people. It can take a lot of energy to get up and, get in the shower, trying to wash your hair. It can be exhausting. So maybe doing it at the end of the day where the next thing you do is get out and you get into bed and go to sleep. So it can be part of that sleep hygiene routine. Movement, I said I'm not a big fan of exercise. The word gives me anxiety. So I prefer movement. I can get up and move. I'm not going to go to the gym and exercise, but I can get up and continue that movement piece. Making sure that you are compliant with your medication, not changing your meds and not stopping your meds without talking to your healthcare provider. And sleep. So, developing that pre-bedtime ritual, having a routine, you take your makeup off or, wash your face, brush your teeth, all of these things that you do at the same time each night to kind of prepare you. One of the big impacts on sleep is your sleeping environment, especially now because we have so many devices that we have with us 24/7. So I really encourage people to stop using electronics at least 30 minutes before you go to bed. That blue light kind of keeps your brain going. So really kind of reducing that before you go to bed can be helpful with that sleep environment. Turning off your TV, your phones, your tablets when you're going to sleep. And even maybe having a specific time that you turn the lights out, like regardless of what's going on, everything goes off at 11. That's kind of the rule at our house. So the second golden rule. So now we're at planning. So we're going to plan self-care into our lives. The purpose of planning is that this is an intervention tool. It's kind of a fail-safe that you create filled with your favorite self-care activities. So it's how to kind of move forward with self-care when you are struggling. And having this customized plan is kind of a preventative measure. You're kind of designing a roadmap for you for moments when you're not in crisis necessarily, but at moments that are a little bit more of a struggle to cope with. So you know what your stress levels are and the resources available to you. So kind of taking these different pieces. Having a plan takes kind of that guesswork out of what to do and when to do it when you're in one of those difficult moments. It really kind of helps you be able to see, oh yeah, this is what I can do. Oh, I actually went that too far. Sorry. Self-care plan kind of helps you stay the course. It's easier to stick to it once you kind of start this up and you start doing it on a regular basis. You kind of get out of that trap of making excuses. It really helps to establish a routine. And so you can even I have a friend who, we're kind of self-care partners, and we check on each other on a regular basis. Sometimes it's not even like a whole conversation. It maybe that we have a funny meme we're going to text each other, but it's just kind of that knowing someone else is out there and thinking of you, that kind of is helpful. So plan, making it visual, be creative. And just as a side note, the care plans that you see on the previous slide, this one and the next one, there are all blank examples at the end of it as well that you can utilize to kind of make your own plan. So, what do we need to do to create this plan? So kind of breaking down things, taking things and breaking them down into a list. So this model breaks it down into mind, body, and spirit. Some people, want to do it like work, emotional life, relationships. So there's different ways that you can break all of these things down. It's just what works for you and how can you best meet the needs of yourself. So maybe it's spending time with friends, being active, but have fun and be creative. I mean, this is be real with yourself. What works for you and what doesn't. So identify some of those stressors in your life and kind of start to address them by using self-care. Find different activities that kind of reduce some of those stressors. I know that figuring out where you are in your self-care world can be a little difficult in the beginning. So also in the back at the end of the presentation, there's also an assessment tool that helps you figure out your self-care and where you're at in that process. So also need to think about any barriers that could be in your way when you're trying to plan this. So if you want to go to the gym every day, but you can't drive, that's kind of a problem. So we need to either kind of change that self-care piece, or we need to find a new way or another way to get there. Could you Uber? Could your neighbor take you? So really kind of thinking about some of those barriers that would potentially provide an excuse on why you wouldn't do some of the self-care. And include your friends. I really think that this is an important piece, because if you include other people and you're sharing this, it really holds you accountable to a different level. They're able to question, how's it been going? Have you been taking care of yourself? So it really provides an opportunity for others to talk to you about it and keep you honest on doing it. So here's another self-care plan. One of the other pieces with a self-care plan is emergency self-care, being prepared, having something down there that you can do in the moment if things are escalating and you're really struggling. Maybe it's the hotline number or something along those lines. But just to have something there so that in the moment you're not trying to figure it out. Make a commitment to yourself. I like this example, thinking about the flight attendant who says, you need to put your own oxygen mask on first so you can help before you can help others. You need to make your self-care your own commitment. You deserve it, and then you would be able to kind of be refilled and be able to help others. I know that making a commitment like this can be challenging, but you need some time to explore those reservations. Like, why am I feeling this way? Why am I struggling with this? Do I tend to put other people's needs before my own? So now I'm having difficulty trying to take care of myself. Really kind of taking those things into perspective and thinking about what is best for your own personal well-being. The next piece would be following your plan, implementing, keeping track of how things are going. Like an athlete trains for a race or some sort of event. Self-care requires that you practice these things regularly, just like an athlete would. Be realistic with yourself. Remembering all of this takes time for something new to become a routine. There will be moments that you will not do so well and moments where you'll be okay. We're all human. Don't punish yourself. Instead, refocus and recommit to the plan. This way, if you find yourself like on the edge of that void staring down, you'll be prepared. So just remembering that self-care is always a work in progress. So just the benefits of the plan, I really wanted to kind of just stress, as I've said in several different ways, but you can't pour from an empty cup. Take care of yourself first. So thinking about the benefits from using self-care, increased productivity. Increasing that productivity increases your happiness and your well-being because you're able to say no to things and tasks where you're overextended, giving you more time to address some of the things that really matter. A healthcare plan improves even physical health because you are taking care of yourself mentally and emotionally, which can help with some of that physical piece. We talked about some of the consequences of not doing self-care can be increased aches and pains. So this is an easy, healthy option. Taking better care of your health is going to affect your overall approach to life and kind of how you view it. It increases that positivity piece. And giving more. I think this is kind of like a catch-22 here. It's a plan that enhances your happiness in life and quality. But happier people have increased happiness and give more to others in that process, which then makes us feel better as an individual. So awareness. This is that third golden rule. And so we really need to be aware of the things that can impact our self-care. Do we have emotional triggers? One that's really a big focus right now here recently is the news. And an emotional trigger for a lot of individuals is that we're seeing the news on COVID. It's, talking about death counts and how many people are dying and how, we don't know how we're going to get out of this. or even the political, someone's blaming something for something and back and forth, and it's just really just negativity. But some people are really drawn to it, and so they'll sit and watch the news for long periods of time. So, maybe you need to reduce that exposure to the news and set some boundaries. Many times I get caught up in my own to-do list and obligations, and the anxiety that surrounds them that I don't even notice until like my neck is hurting or my shoulder's hurting. The times when I'm personally most successful is when I'm taking the time to like check in with myself and kind of know where I am with myself. So paying attention to my body. It has to start with that self-awareness piece to break that cycle of push, push, push. We need to establish the time to do that. We need to establish rituals that break us up out of everyday patterns. So I like the idea of rituals because I think it's an easy thing to add to your life to help you become a little bit more aware. So rituals can be very simple. It can be like if you stop at a stoplight and every time you hit the stoplight, you take in 3 deep breaths. But as you're doing that, you kind of are thinking about the breath and how you feel kind of relaxed as you exhale each time. When you're eating a meal, paying close attention to what you're eating, how you're eating, the chewing, the taste, taking in all of those different pieces. So establishing these rituals really does break that cycle of push, push, push. And it really brings awareness of our mind, body, and spirit to the forefront. It gives us a chance to kind of tune into what we're feeling, what we need, and how we can best care for ourselves. Bottom line in all of this, without self-awareness, there can be no self-care. Without self-care, there's no growth because we're too exhausted from the obligations of our lives to think about what we need, want, or desire. So a question to think about is, what about you? Where do you struggle in adding self-care to your life? What self-care, self-awareness rituals do you already have in your life? So I put in this section on resilience. And I think I don't think it's talked about enough. Resilience is what gives people the psychological strength to cope with stress and hardship. It's part of being aware and having that awareness of your own strengths and weaknesses and using those strengths to become more resilient. So dealing with change or loss, it's an inevitable part of our lives. At some point, everyone experiences different degrees of setbacks. But resilient people are able to utilize those skills and strengths to cope and recover from problems and challenges quicker than others. These problems can be job loss, financial issues, illness, natural disasters, medical emergencies, divorce, death. Instead of falling into despair or hiding from problems or using unhealthy coping skills, resilient people face life difficulties head on. This does not mean that they experience less distress or grief than others, but it means that they handle the difficulties in a different way. They focus more on the strength and the growth. A lot of times they even emerge stronger after they've been through something that's very difficult. When we lack that resilience, we become easily overwhelmed by experiences. We may dwell on problems, focus on the disappointment or failures, which then drive us to negative destructive behaviors. So maybe we start drinking heavily because we can't cope with what else, the other things that are going on. So it could drive us to that negative coping skill. Resilience does not eliminate stress or take it out of someone's life. People with resilience aren't looking through rose-colored glasses, nothing along those lines. They understand that setbacks will happen, that life is hard and it can be painful. They experience all of these things just like all of us do, but their mental outlook allows them to work through some of these feelings and recover quicker. So these are just some tips on building resilience. And, you know, some of these are harder than others. Accepting compliments when they're given to you. To me, that can be a really hard one for other people. Share your burdens with others, especially those who've been through the same things. That's kind of where that support group piece comes in. When I started facilitating, I didn't realize how badly I needed it too. So it's been a great experience. So coping strategies, attitudes, daily living. These are just some, I think, successful coping strategies when you're talking about chronic illness. So I think the key to successfully coping with chronic illness is to acquire kind of the right mixture of skills and attitudes. And by combining these things, you can promote a positive or a realistic approach to your health. So attitudes for successful coping would be advice about maintaining a positive attitude, which can seem frustrating when you're in pain or you're exhausted, but there are certain attitudes and beliefs that have been associated with people who cope well with chronic illness. And that's some of these things that we have listed here. You know, focusing on each day, you know, taking things day by day, treating problems as challenges, something that you can overcome. Be willing to ask for help when you need it. But also looking at our daily living tips. So being organized, setting realistic goals, prioritizing will really help you cope well on a day-to-day basis. Decide what's really important and, you know, what things can slide. Live your life as fully as you can and don't try to do too much or feel guilty if you can't get stuff completed. You know, one of the things is we just have to kind of watch for those warning signs and stop and rest as soon as you start to feel tired, listening to your body and the messages it's sending. You can even keep a journal of your symptoms and feelings and activities. And that might help even when you go to see the doctor, asking questions and seeing some of those patterns. So here's some positive coping skills. You know, we're gonna jump right into this. There are so many of these. There's no easy way to list them all. These are just a few that I think are fairly common, but easily doable even if you're at home during COVID. We can still do puzzles. We can kind of be creative. A lot of adult coloring has come back in style. And so it's really awesome. You know, there's different things for everyone. For me, one of the big things that I do for self-care or a positive coping skill is painting my fingernails. As silly as that sounds, I have to concentrate on it. So if I'm wearing a dark nail polish, if I'm not paying attention, I will spread that all over my finger and I'll have a pink finger. But also with my lupus, I also struggle with like fine motor skills sometimes. So I have to really concentrate on the actual painting part of my nails, because if I don't, I'm going to paint my whole finger. So when I'm doing that and completely focused on that, I'm not thinking about anything else, and I'm only focusing on painting my nails and not being successful. Here's some of those negative coping skills. We've kind of touched on these things already on some of these, but these are especially important to bring up because of COVID. Some of these negative coping skills are very easy to do if you're home alone, you're frustrated, you don't know what else to do, you have increased depression or anxiety. So if you're really focusing or you think you are using some of these negative coping skills, you really need to discuss that either with a family member or a physician. At the end of the presentation, I also have various hotline numbers that that you can utilize if you are struggling with different issues. So love yourself. Without your flaws, you wouldn't be you. This is just a good reminder for us as lupus patients. Yes, we have flaws, but we can embrace them instead of being negative, and this can be done all through self-care. So mindfulness, it's a state of non-judgmental awareness that's happening in the present moment, including the awareness of one's own thoughts, feelings, and senses. So a mindfulness practice is a state of mind rather than a particular action or exercise. It can be difficult to achieve. So some of the components, that awareness piece that we talk about, noticing your thoughts and your feelings and sensations, it's not to clear your mind necessarily or to stop thinking, it's to become more aware of your thoughts and feelings. And the acceptance that thoughts and feelings that you notice should be observed in a non-judgmental way. So I notice I'm feeling nervous. Simply state to yourself, I notice that I'm feeling nervous. There's no need to judge or change the feeling. A lot of benefits come from mindfulness. So it reduces depression and anxiety. It improves memory. Improves the ability to adapt to stressful situations and to kind of help manage your emotions. So whether you use meditation, yoga, prayer, focusing your attention on the present moment rather than thinking about the uncertainty of the future, these things can really help manage your distress. These are just some examples. There are a few in here that are my favorite. We're going to go talk a little bit more about deep breathing and head to toe relaxation, but smiling is one of my favorite things to do. When you're like walking through, you smile, you nod your head. It drives me nuts with COVID because we are all wearing masks, so we can't smile and have that connection with people in the same sort of way. I personally find it really frustrating. Rituals, we kind of touched on those before. My cat jumps up on my lap every morning as soon as my alarm goes off. And I sit there and pet my cat for about 5 minutes or so, and then I get up. That's kind of my morning ritual. So a breathing exercise. So this is one of my favorites. It's easy to do. It's by taking a purposeful, slow, deep breath. And when practiced regularly, this can provide almost immediate relief from stress and anxiety. So you inhale and breathe slowly through your nose for 6 seconds, and then you exhale for 6 seconds. So if you're doing this and it's not working, then slow down. The most common thing is that people are breathing too fast. Really count those seconds in your head and really focusing on that, because that counting serves a purpose. It takes your mind off your source of anxiety. And if your mind does start to wander, just focus it back to that counting piece. The length of time on the breathing is all subjective. Do whatever works for you. If you have lung capacity issues like I do, sometimes I will do it for 4 seconds instead of 6 seconds. Another mindfulness activity is being aware of your senses. So kind of grounding you in the moment through your senses. It's making a conscious effort to notice the present moment through each of your 5 senses. So 5 things you see. Look around and notice 5 things maybe you hadn't noticed before. A pattern on a wall, a light reflecting on a surface, some sort of knick-knack over on the other side of the room. Next, do 4 things you can feel. Maybe it's the pressure of your feet on the floor, your shirt resting on your shoulders, the temperature on your skin. Maybe you need to pick up an object and notice its texture, its weight, something you can feel. Then 3 things you can hear. Notice those background noises. that you'd been filtering out before, such as like an air conditioning running, birds chirping, maybe the ceiling fan going. 2 things you can smell. So flowers, coffee in the house, freshly cut grass. These also don't have to be pleasant smells, you know, now that you're not always going to have all pleasant smells, but just be mindful of those things. And then the last is one thing you can taste. Some people use this as like popping a piece of gum in their mouth, taking a sip of something, eating a snack. Just kind of notice how things taste in your mouth. Just kind of thinking about those pieces. Now, the next couple of slides, I'm not going to go through with you, but I wanted to have them in here so that you really could learn how to do some of this head to toe relaxation. It's a scan of your body, and it's another grounding technique, kind of like your senses. So this particular exercise starts with your toes and kind of works up. I personally do it the opposite. But this is the entire relaxation head to toe piece. It takes you through all the different parts of your body. There's many different ways to do this. When I like to do it, well, I'm not driving right now to and from work because of COVID, but it was something I would do when I would get off work and get in my car. I would kind of do a check. Okay, am I holding the steering wheel too tight? Am I, got my shoulders all scrunched up? Are they all tense? Am I clenching my jaw? So it's really just doing that body scan when I get in the car and kind of reminding myself to relax those muscles. I don't need to be this upset. I also tend to do it at night before I go to sleep, kind of as a check. I know my own problem areas. I tend to clench my jaw and kind of shrug my shoulders, tighten those muscles. So really focusing on that relaxing piece of that. So positive thinking is another huge piece of this. It sounds simple, but it takes time and practice. Just finding positive, optimistic ways to kind of approach things. So we all kind of know there's certain areas that we tend to be more negative. My husband has a tendency to get frustrated with drivers when he's driving. And he'll come home and he'll tell me like, oh, someone tried to run me off the road. Someone tried to do this. And he'll be talking about that over and over and over. And I'll stop and I'll say, okay, that sounds like it sucked. But what went well today? What went well while you were out there? He kind of picks on me and he calls it my Pollyanna glad game from the movie Pollyanna. But he does it and it does change his perspective. He comes in really frustrated and angry. We play the glad game and he's in laughing and kind of playing along. It does shift his mood. Really just check yourself throughout the day is what I really encourage people to do, to evaluate, are you overthinking things? Have your thoughts been negative this morning? And just find a way to put a positive spin on things. Sometimes it even includes like storytelling. So one of the things I do, which of course also bothers my husband since he gets frustrated driving, if someone cuts me off while I'm driving and I'm driving down the highway and some guy cuts me off, instead of getting mad and throwing a fit, I kind of do this storytelling piece where I say, well, clearly he's in a hurry. Probably his wife is in labor at the hospital. And it sounds silly, but that storytelling piece kind of makes some of that stress and anxiety and frustration kind of dissipate. If someone's going to the hospital because their wife's in labor, well, yeah, I'd be hurrying too. So it's different for each person. The other piece is just that negative thinking. Make sure that, what is listed is just some very common negative self-talk things. So like the filtering is magnifying the negative aspects of a situation and filtering out all the positive ones. Personalizing. If something goes bad, or you just automatically assume that it's because of you. So like if you hear your friends canceled a night out, you guys were all going to go do something and it gets canceled, you would instantly think that it was canceled because of you. Catastrophizing, that's really just automatically thinking the worst is going to happen, there's no other option, that's just how it is. And polarizing is either good or bad. Either I'm perfect or I'm a failure. So really not being able to see that middle ground, that kind of gray area. This is just, whoa, there we go. This is just another thing about self-talk. Kind of instead of saying this, try thinking this. And it's things that you can say to yourself. So this quote on here, I think is really powerful. It's not what we say out loud that really determines our lives. It's what we whisper to ourselves that has the most power. So one of the mindfulness exercise is self-daily reflection. And in order to have self-awareness, you must do this self-reflection. It requires setting some time aside, hopefully every day. And if you can't do it every day, start really small. Maybe it's a couple minutes before you go to bed, but start simple. Once again, these are habits that take time and are challenging to develop. So as you on your screen, you can see the different questions coming up. So sometimes these are just examples of questions that we can ask ourselves when we're doing that daily reflection. Some people, they have more benefit from this if they have these questions and then journal the answers or kind of keep track that way. I personally don't journal, but when I'm doing some of that mindfulness and that head to toe relaxation, this is kind of part of what I kind of go through. It's like, what did happen today? Because there's something I could have done better. What could I have done for somebody else? Is there ways that I could have been more impactful? So the better you like this and you get used to it, you'll actually obtain better results and benefits the more you use it. So it's just for me, it's just a really great way to kind of check in with myself and kind of see what else is going on, and to make sure that I'm not thinking completely negative and that I can see the positives in the day and kind of help me move forward. So this is my list of self-care books. So I'm a huge reader, so I included this on this presentation because I really gain a lot from some of these books. The first one is Gifts of Imperfection. I personally think anything by Brené Brown is amazing. She is a social worker that is a social work research / storyteller. She focuses on vulnerability and shame. And it's just really interesting, her perspectives on how that has helped reshape some of my negative thoughts and turning it into acceptance and positive thinking. The first 3 books that I have listed here are probably my favorite 3 books. But these are all, on this particular slide, these are all books I've read and really, really enjoyed. The second list here are all books that are on my to-be read list. And they're on that list because someone has told me that they loved it and they benefited from it. So these are just additional options. I do want to point out, with COVID and everything going on, our mental health is really kind of in flux. And so if you are feeling overwhelmed with emotions, like sadness, depression, anxiety, or you're having thoughts of harming yourself or someone else, please call 911 or use the suicide prevention hotline number. like I said, I do have some resources coming up of different hotline numbers. This is just a list of some of the different technology that's out there. It's really, most of the technology is really focused for someone who has mild depression. Just remember that these apps are not a substitute for therapeutic, professional mental health therapy. They're just great for in-the-moment relaxation. And if you are seeing a therapist, I would talk to your therapist to see if they have like a preferred app that would complement their type of therapy. So these are just different ways that we can connect through technology to help our own self-care. Here's those hotlines hotline numbers I was talking about. These are just some other resources in the community that you would be able to utilize if you were needing some help. This is, the Lupus Foundation is a great resource. They have the most, the Lupus Foundation has the most up-to-date health information for COVID. So if you're looking for information, you can go there. Amy also mentioned the support groups. There's one on the second Thursday of each month and one on the fourth Wednesday of each month. These are those resources I had mentioned. It kind of gives you a place to kind of get some of the blank self-care plans and also the progressive like grounding tips and relaxation. And that's all I have. These are some of my favorite sayings that I've kind of added to the end here.
Oh, thank you, Bree. If anybody, we have about 8 minutes left. So if any of you have questions, please just ask them in the question section. I wanted to just say a couple of things. I hear so often from people with lupus that they feel so out of control with lupus. And I think COVID has made that much worse. And some of the tips that Bree has provided today, I think are so important. I think people with lupus don't take care of themselves enough. They get consumed a lot, I think, in their disease and, people not understanding the disease, that they don't do enough to take care of themselves. And so I just want to reiterate what Bree was saying, and even outside of COVID, all of this is really good information. Especially, I just wanted to just touch on a couple ones that you mentioned, Bree, that I thought were great. One of them is sleep. We hear from people with lupus constantly that they have trouble sleeping. Would have been a good question for Al. I bet he's left us, but he does some research about sleep and lupus. What is it? Is it you can't sleep because of pain, or you have, there are all kinds of theories around sleep, but I think some of the tips that you provided were excellent in terms of ways that you can get better sleep. Sleep is so important for everyone, but especially if you are living with, a chronic disease like lupus. I also want to reiterate, because I've been doing it myself since COVID, is eating. I'm just not eating well. I'm not exercising as much. I wish I was, but I'm working from home. And so, I think those were really, really great tips as well. So if you are somebody living with lupus, there are things that you can do to take care of yourself so you don't feel completely out of control. And so I hope you will take some of this to mind today. This is being recorded. I should have mentioned that before, and we are going to be sending out the slides. So everything that Bree has shared today, you will get as an attendee here, and you'll be able to look at all of that. So we do have a couple of questions, Bree.
Okay.
I'm struggling to get my partner to take on an equal share of the household and work with the kids. How can I get through to them without having a breakdown and a flare every few months?
That's going to come back to communication. That communication piece can be really challenging. There needs to be a very frank conversation, and maybe you need to meet with a therapist or some sort of mediator to have that conversation. But having that open and honest conversation is where that needs to start. One of the biggest challenges is we will continue to do things because we don't want to complain, or we're on our own health and things in jeopardy. And we bottle some of those things up, our feelings, our thoughts, frustrations with other people. Having that open conversation to start, it may not happen on the first time you're talking about it, but it has to continue, and you need to stress to the other person what is going on. There isn't an easy answer for that one, and I apologize. It's a hard situation.
Yeah, I think it also, Brie, goes back to this whole notion that a lot of people who are living with lupus, their loved ones don't really understand the disease. They don't understand that while you don't look sick, that doesn't mean that you don't feel sick. And so, again, I think some of it is trying to explain that. We've been working on some things here at the foundation, ways that we can help you educate people about the disease, and we're hoping to be able to roll some of that out next year. So
that's awesome.
People understand. Yeah. Okay, we have another question. When you're in pain or dealing with issues from lupus, what tips do you have to help think about mindfulness, meaning like in the midst of the pain?
So that's where that self-care plan comes in play. And I know a lot of people don't actually do it. And I think it is really important. It sounds silly, but having that next to you, whether it be on a refrigerator, on your nightstand, that is your reminder. When you are feeling miserable and you don't know what else you can do, looking at that reminds you of the things that make you feel better. I know when I'm working too much and I'm not taking care of myself, my sleep starts to go, I stop eating healthy. All of these things seem to change. One of the things that kind of helps get me back to center easily in the house is going back to having like 30 minutes before bedtime where all I do is read like some book for pleasure, a murder mystery or something along those lines. And that kind of helps me straighten out. I do have things listed on my nightstand of things that I can do if I'm not feeling well. That's that important piece of it.
Yep. Okay, we just have about 2 minutes left. So if there are any other questions, please post them now. I do also want to remind you, I know Brie put it in her slides, but about our support groups. They used to meet in person, but because of COVID, we've now moved them online. And so you can either call in or you can come in through a computer. If you're living with lupus and you don't know anybody else with the disease, these are great groups to join just so that you can, there are other people who get it. We often say if you don't got it, you don't get it. And so it's a great way for you to be able to connect with other people with lupus, to share ideas. So I really encourage you to give it a try. There's no pressure. You can join, and if it's not for you, fine, but we really do encourage you to give it a try. A lot of people have enjoyed having the online format. It's easier than having to get in your car and drive somewhere. So we really do encourage you to check that out. And I'm going to share some other ways that you can get engaged. So seeing no other questions, I think we will wrap up. Thank you very much, Brie. We appreciate everything that you do for the Lupus Foundation. Okay, great. So we are going to move right into our next presenter. And we'll switch screens here. Angie, if you want to share your screen, and Brie, you can unshare yours.
All righty.
And your camera. And Angie, if you want to bring your camera up, that would be great. There she is. Okay, so our next presenter is somebody that we've gotten to know really well over the past year. Angelia Drake is a patient engagement liaison at GSK GlaxoSmithKline. She's a graduate of George Washington University School of Nursing in Washington, D.C., and Lewis University School of Nursing and College of Health Sciences in the Chicago area. She has over 20 years of nursing experience that includes clinical research in the United States and outside of the United States in academic settings and biopharmaceutical industry experience in various roles. She currently is a Doctor of Nursing practice candidate at Abilene Christian University in Dallas. Angie's going to share a few ways that you can manage your lupus with tools that are provided by Us and Lupus. And as I mentioned at the beginning, GSK Us and Lupus is sponsoring this event. It has sponsored a number of events for us over this past year. And we really appreciate their partnership and their support. And they have some really great tools. And when Angie's finished, I will share a couple of things, tools that the local chapter has. So I'll turn it over to you, Angie. Oh, you're muted, I think.
How about that? Am I unmuted?
You're good. You're good.
Perfect. Thank you, everyone, for coming to this fabulous presentation today. I've learned so much from Dr. Kim and Bree, and I think these resources that I'm going to share with you today will align nicely to what some of the things that Bree has mentioned today. One thing I want to talk about real quickly is that communication challenges with physicians and patients is one of the main challenges with lupus and managing it. And I just hope that some of these resources will help you maybe get organized so that you can start tracking your symptoms and writing your questions down and getting ready for your appointment, so that when you go in to see your healthcare team or your physician, you don't forget those important symptoms or questions that you want to ask during your appointment. So again, I just want to show you real briefly, this is a great image to show you the gap in communication between patients and their healthcare providers. We did a survey back in 2011, and we found that 52% of patients reported that they minimize their symptoms when they're talking to their doctors. And then we found also that 72% of physicians were unaware that these patients were not reporting all their symptoms. So you can imagine with that gap in communication, that may impact the way that you and your doctor come up with a treatment plan, or the way you're, are going to feel after your appointment. So I really encourage you to track your symptoms and write your questions down and have them before you go into your doctor's appointment, so that we can close this gap of communication and get you the best help that you need. So some tips for communicating: again, report all your symptoms regardless of whether you believe they're lupus related or not. Bring a list of your healthcare providers, and also make sure you bring a list of your medications that you're taking. So in a way that you can keep a list is you can keep a journal. You can just find any kind of journal that you may like, whether it's a regular journal, or if you want to do it in your phone. You can also make sure that if you can get access to some of your medical records, it's always a great idea to grab those records when you see your doctors at the end of the appointment. Ask them if they can either print you off the clinic note and your labs, or if they can send those to your home. That's a great way to review your information that you went over with your doctor in your appointment. Also, make sure that when you're jotting down and recording your symptoms in a journal, make sure you note whether your symptoms have changed over time. Make sure you document how it's affecting your daily life. Document whether or not it's preventing you from doing the things that you really enjoy, and also document and tell them if you're feeling isolated or depressed or frustrated. These are really good pieces of information that your doctor needs to know in order to help you. So GSK has a website called usandlupus.com, and we're also on social media as well as Facebook and Instagram, and it's called Us and Lupus. And if you go to either of these platforms, you will have access to a lupus checklist, an impact tracker, appointment prep guide, a dictionary that I find very helpful for patients so that they can understand some of the terms that might be said during a clinic appointment. So this first resource is a checklist, and I really like this resource, and I really encourage patients to download this checklist at usandlupus.com. And what you can do is the night before your appointment, before you go in and see your rheumatologist, you can actually check off what symptoms might have been bothering you in between your appointments. And on the form it says, look back the last 3 weeks. You can even look back just the last 2 weeks and just record, are some of these symptoms bothering you, such as like chest pain? Are you having any infections? Have you had any skin rashes? Are you having aching muscles and joint pain and fatigue or hair loss? These are important symptoms to make your physician aware of. And I think this is just a great tool to check it off and have it with you when you go into the appointment, so that you don't forget to bring up what has gone on with you in between your appointments. If you're like me, sometimes I go into my appointment, and if I don't prepare, I don't bring up any of my symptoms or my questions, and then I leave my appointment and I haven't addressed the main things that I really wanted to talk about. So this is a great tool for you to use. It's on usandlupus.com, and if you're unable to download these forms, please let Amy know and we'll help you get these forms to you. This Lupus Impact Tracker is another great tool that you can use, and you can use it the night before you go into your doctor's appointment and just reflect back on, have you been waking up every day feeling worn out? We have a scale of 0 to 4. You put 0 for no, you haven't had any of these issues that are on this form, or you put, 1, 2, 3, or 4 on how your lupus is impacting your life. Some other questions on the form is, you felt pain and achy in your body. Again, you rate it on the scale, and that's great information to share with your physician. Also, you might want to put on there, what activities you're not able to do. So one of the questions says, I'm unable to do my usual activities or plan any activities. So if you just put that on there and make a little note of what you're talking about, these are great ways to remember what has been going on with you since you saw your doctor last. Also, there's a question on there that I love. Have you had trouble concentrating? That's something that we probably don't even think about to mention to our doctors. So again, use this form, fill it out. You can sit down the night before you go into your doctor's appointment, and that way it helps you get ready for those appointments and ready to talk about what you want to talk about, so that you can work on whatever symptoms or whatever impact lupus is having on you. Again, we just talked a little bit about a journal, but one of my favorite things to do is either journal in a standard, little journal like this, or get your notes on your mobile phone. It's a great way to document your symptoms. And one thing that I really like to do, I like to do this myself, is I get a calendar, whether you want to do it on your mobile phone or you want to have just a basic standard calendar. And then each day, at the end of the day, just record if you had a good day or a bad day. You could put a check mark for a good day, you could put an X mark for a bad day, and next to your X mark, just write down what was bothering you that day, and try to think about what's been going on in your life at that time, so that you can have this discussion with your doctor. Because when you bring in, 3 months worth of a calendar, you can see a pattern of whether you're having many great days or you're having bad days and you're struggling with some of your lupus flares or symptoms, or whatever it may be that's really impacting you. This is a great visual to share with your physician so that they can get insights on how you're doing in between your appointments. This is a great prep guide. It's on usandlupus.com. All these forms that I'm showing you and sharing today are on usandlupus.com. And what's great about having an appointment prep guide is, again, the night before your appointment, you can sit down and you can just go through this checklist and make sure, do I have my lupus checklist completed? Have I journaled down all my symptoms? Have I journaled down any concerns or questions that I want to talk to my doctor about? Have I used the impact tracker form? Have I documented how lupus is impacting my life, how it's affecting me every day? Also, maybe I want to consider bringing an appointment buddy with me so that I can have someone who can listen and hear and help me maybe ask questions during my appointments, or remind me during my appointments of things that maybe I've forgotten to mention to my doctor. They're also a great person, having an appointment buddy is another great person to kind of debrief with at the end of your appointments, just to kind of go over what you agreed to, what you discussed, if there were any changes in your treatment plan or your regimen. Also, try to get what medical records that you can get. Most doctors have a patient portal where you can go in and download your clinic notes or any labs that you might want to share with your doctor. With lupus patients, we have many doctors, so it's just a good idea to get those clinic notes if you can get your hands on them, whether it's through the patient portal or you just ask your physician to give you a copy. That way you too can go back and review the notes that you and your physician had, and what you talked about, and what new things might have been added onto your regimen, or what things might have been removed from your regimen. It's just a great way to keep track of everything that you and your physician have talked about and agreed to. Also, make sure, in your journal, you are writing your questions down. If you try to remember those questions without writing them down in your doctor's appointment, chances are you'll forget to ask the questions that you really wanted to ask, because there's so many things going on in your appointment. Your doctor's asking questions, and sometimes we get a little intimidated in the environment. I know I do sometimes. So if I have my questions written down, that way I can ask my questions. If I have my symptoms written down, I can share my symptoms, and I can make sure we're talking about things that's been on my mind in between my appointments. And again, make a list, if you don't already have it, make a list of your medications. We need to know, physicians need to know, nurses need to know what medications you're on, what doses you're on, how often you take your medications, and how you take your medications. That's great information for your physicians. So each time you go into your doctor's appointments, try to remember to bring your medications. That's very, very important pieces of information that your doctors need to help care for you. So on usandlupus.com, there is a lupus dictionary. I spoke a little bit about this. I love this dictionary. You can download it. It has several clinical terms that are used in the doctor's offices or in the hospitals. And I encourage you, if ever anyone, a nurse or a doctor, mentions a term that you don't understand, stop them and ask them to explain what that term means, because a lot of times when we're in the clinic or in the hospital, we start talking these hospital medical terms. So this dictionary is a great resource for you to download and always have in your purse or in your backpack or briefcase or wherever you want it, so that you can go back and look up the words that maybe you didn't quite understand, or the words that you actually asked the doctor or nurse to explain when you were in your appointment. So this is such a great resource. All of these tools are amazing. I think they'll help you get organized and maybe make sure that you're asking your questions and sharing your symptoms when you're in your appointment with your doctor. And you can do this whether you're doing a virtual appointment or if you're doing a face-to-face appointment. It's just a great idea to get in the habit of really starting to prepare for these appointments, because if we try to rely on our minds and our memories, a lot of times a lot goes on in those appointments and we forget to mention anything. And that's really, really important, because we want to close that gap in communication between patients and their physicians. So I just want to leave you with, just remember, as a lupus patient, you're not alone. So don't be embarrassed to ask for help. Utilize your physicians, your nurses, utilize your family and your friends, and always stay connected with the Lupus Foundation of America, because Amy and Becca, they have great resources and they put on a lot of great education for you, and you can actually bring your family members into these appointments or into these meetings with Lupus Foundation of America, because it's a great way to educate your family as well. That's all I have. My presentation is pretty short today, but I want to share one more resource with you. And what you should be seeing on your screen right now is a QR code. And what this QR code does is, if you take your camera out, and my phone went to sleep for a second. If you take your camera out and you put your camera right up to the QR code, what happens, I don't know if you can see this or not, is you'll see the link come up, and it's the usandlupus.com link. And that's where you can get all those resources for free. There's no username or password required. And you just go in and you fill out this form on here. And what will happen is, if you fill out this form, we'll mail you these resources. But if you can't wait for those resources to arrive to you, you can actually go online and you can print those resources off. I know it's a little hard to read my phone via this virtual modality, but you're able to actually download those resources that I shared with you today. And I hope that you will take the opportunity and utilize them, because it may help you get really organized and make sure you don't miss anything that you want to share with your doctor. And again, close that gap in communication. That's all I have, Amy. Are you still there?
I'm here, yes. Thank you very much, Angie. I don't know if anybody has any questions. If you do, go ahead and ask it now. But as Angie said, if you don't have access to be able to print some of this and you really want it, we're happy to do that for you if there's some things you need us to print. So just let Becca or I know that you'd like to get some of these materials. I think they're super helpful and important to keep you organized so that you can make the most of your doctor's visit. So thank you very much, Angie. If you want to go ahead and Becca, can you go ahead and share my screen at this point? Or maybe can I do that? Yes, okay. So I wanted to just share with all of you before we wrap this up some of the resources that we have available at the Heartland chapter. Hopefully you can all see my screen at this point. This is our website, our homepage, and the website is very simple. It's lupus.org/Heartland. So if you go there, we have lots of resources available. I just wanted to point out a couple of things to all of you. Up at the top, there is where you want to look to find resources. If you click on Find Help, that will take you to our page that lists all of the programs and services. This is where you can find out more information about our support groups, about our camp for girls and women, young women who have lupus, education and information. So this is really a great place to go when you are looking for information. The other thing I wanted to point out is the resources page. Bree had specifically mentioned this, but on the resources page, we have spent a lot of time trying to build a resource library for our chapter territory. So if you click on the Heartland chapter resources, it will take you to this page that has as many resources as we could possibly find. And they're all kind of divided by the kind of help you might need: transportation, legal services, utility assistance. So that's all there with links for you. So I hope that you will check that out, because I think they're really great resources. The other thing is you'll find in some of these areas a link to our YouTube channel. And our YouTube also has, like this conference today is being recorded and we will upload it to our YouTube. So if you've missed something in the past, going to our YouTube channel is a great way to be able to do that. We will also be sharing the recorded presentation and the slides with all of you after this. So they will be sent to all of you, so you'll have that. The last thing I want to mention is what is the next thing that is coming up for the chapter is our walk. And for those of you who've been with us before, who've been around for a while, you know that our Walk to End Lupus Now is our biggest fundraising event. It's a great event that brings people with lupus out and with us. And unfortunately, this year, because of COVID, we're not able to hold the event in person. So we are doing something new this year. It's called Walk to End Lupus Now, Walk Your Way. And so if you go to our homepage and click on the walk button, or even up at the front, up at the top, there is a button to get to our walk. And if you click on more information and register, you'll get to this page. And this is where you can register. You can start fundraising. You can see all the different options. You can go up here and find out all the details about the walk. And the thing is, the walk is however you want it to be. So you can have a walk in your community, in your neighborhood. You can, walk around the block, or you can get maybe some of your family and friends together and have your own walk, in your neighborhood, at a park, whatever you want to do. But the most important part of this is the fundraising component. We count on the money raised by the walk to help fund programs like this and programs like our support groups and all the educational materials and information that we have. And unfortunately, we are way behind this year in fundraising for our walk. And that's probably going to end up impacting what we're able to do in the future. We're down significantly from where the walk fundraised last year. So I'm just asking all of you if you can help us out by either you can make a donation up here at the top. You can just simply make a donation, or you can register and start fundraising, asking your friends and family to give. we're just really asking for everyone to help us this year. As I said, we are way down in income from last year. And so, we're hoping that we can at least try to pull these numbers back up. Lastly, we're going to wrap up here, but I want to remind everybody that, again, after this is over, you will be receiving an evaluation form. If you've been to any of our events before, we do them after every single event that we have. And the purpose of the evaluation is, number one, to find out what you thought and, to let our presenters kind of get feedback. But number two, it's really important because a lot of our funders want to know that we're actually doing what we say we're doing with the funds that they give us. So it's really important for us to get those back. So I would really encourage you, they don't take long, but if you could just when you get it, fill it out quickly and send it back. And know that we use that information to plan future programs. So it's super important to us. I don't know if anybody has any more questions. I don't see any questions at this point, so I think we'll go ahead and wrap up a few minutes early. I want to again thank all of you for coming out today. I want to thank all of our presenters for kind of sharing their time with us today on a beautiful day like this. I hope you will take the information that you learned today and use it, especially some of the tips that Bree shared. I think those are super important. Becca, you have anything to add? No,
I don't. I don't. Other than just thank you for participating and always supporting us. We just really appreciate it.
Yeah, we wish we could see all of your faces. We wish we could all be together at the walk, and we miss going to Kansas City. For those of you who are on here from Kansas City, we miss seeing all of your faces, and so it's been sad for us too. So we're going to take some of these self-care tips and use them for ourselves as well. But just know that we're here for you. You need anything, just reach out, and we will keep you updated about what's happening in the future. So thank you all. Have a wonderful day. Bye-bye.